want to have them just stand in the middle of the floor when they're just getting ready to start working on standing, with nothing to hang on to. The thing is, we don't want them to be putting all their weight forward on their arms. So I'm going to have Kristen turn around and just put her fingertips down on the table. Okay? So it's there just in case. So she feels a little safer. Here's something I can have my fingertips down to help me with my balance. Okay? It promotes less fear on the patient's part. Okay? So again, the PTA wants to be nice and comfortable, right? Be able to control. Which side of the patient do you think I'm going to be on? Do you think I'm going to be on their affected side or their unaffected?
Yeah.
They're affected. Okay, so we're going to say that she's a right hemi. All right? So, what I can do is I'm going to facilitate again. Okay, I don't want to manhandle her and move her from side to side. I want to facilitate. So the first thing that I want to feel is I want to feel how far does she need to shift to unweight. And the easiest way to do that is to have her shift toward her good side, correct? So I'm going to make sure her feet are about 6 to 8 inches apart. And I'm going to have her shift then over toward her good side, okay? Now I can feel, okay, she shifted as far as she needs to go on this side, and what I want to make sure is happening on her affected side is that her knee is flexed. But I can guard it, because I don't want it to flex too much. What's going to happen if she flexes too much?
She's going to fall.
She's going to fall. So I can guard from the front, but I also can facilitate with my leg, and in back and forth as much as I want, to facilitate her getting that flexion of the knee. Okay? Now she's getting elongation here on this side and shortening a little bit on this side, okay? So I felt how far she needs to shift over toward her good side. I need to use that information then to help her shift over toward me. So what's going to happen when she shifts then over toward me is her knee is going to extend, okay? Her trunk is going to elongate, and eventually then I want that knee to flex. Okay? So I have to build into her with tactile cues. She needs to have extension of the knee, and she needs to shift that far over to me so she can unweight that knee. Okay, so we do it very slowly so that the patient can feel it, and so that you can feel it and control it too. So now I'm going to have her shift back over toward her good side, and I may need to facilitate and then have her flex her knee. Okay? So then ultimately I want her to be able to come back and forth. And we want to get, if we can, a more normal speed in doing this, because you want a speed that's going to be comparable to her walking speed. Okay? Now, because you all are going to be PTAs as well as patients, you're all going to know how to do this weight shift on yourself back and forth. So you pick the card for weight shift side to side, you get up there, you do your little weight shift side, you know, that's end of story. What we're going to do to make it a little bit more difficult for you is we're going to be whispering in the patient's ear, maybe don't shift far enough over toward the affected side, or don't flex the knee on the unaffected side when they've shifted over to, we're going to tell you as the patient to do certain things. Or maybe when you come over, if Kristen's going to come over and shift her and she just keeps letting her leg go, you know, are you going to be there? Are you going to be able to correct her so that she doesn't fall? So we're not going to make it so easy, you know, that you just come in because you all know what to do. That won't help you with working with your patients because your patients won't know what to do. Okay, so we're going to be whispering little things to them about how they might make it a little bit more difficult for you and see how you